Hello everyone, good afternoon and welcome once again to Online Fertility Awareness Program, You and Your Fertility, brought to you by the Love Foundation. I'm still your host, Dr. Love. We are at episode 19 today and we'll be talking about miscarriages. Miscarriages, what it is, the causes and what one can do to prevent or stop them from occurring. So a miscarriage, generally speaking, is the termination of a pregnancy before 24 weeks gestational age. So a miscarriage clinically is defined as the termination of a pregnancy before 24 weeks of gestational age of that pregnancy. So what are the possible causes of miscarriages? Miscarriages can be early, it can be later in the pregnancy. When it's early, it's within the first trimester, that is the first 13 weeks, and there are specific causes for that. When it happens a little later, between 13 weeks and 24 weeks, there are also causes for that. Anything after 24 weeks of pregnancy is termed a stillbirth, because for very specialized centers, they might or should be able to take care of a fetus born after 24 weeks of pregnancy, after 24 weeks of gestational age. So if a pregnancy terminates before that, it means that that fetus is likely not viable, will not be able to survive after the womb, and so that child will likely die. And that is why it is called a miscarriage, a loss, a termination of that pregnancy. But if it happens after 24 weeks, the possibility of the child surviving is there, and if the child doesn't make it, it's probably called a stillbirth or something like that. But if it happens before 24 weeks, it is a termination of pregnancy, or what we generally call miscarriages. So I have said that miscarriages can happen before 13 weeks, that is early miscarriage. So what are the possible causes of an early miscarriage? It could be due to maternal stress, hormonal deficiencies, maternal illnesses as well, genetic abnormalities in the fetus. All these are the ones that can inform early miscarriage in a woman. Illnesses can be as simple as malaria, urinary tract infection, and other febrile illnesses. Those can cause miscarriages. For miscarriages that happen after 13 weeks of pregnancy, probable causes can be cervical incompetence, trauma, also maternal illnesses as well. But it's unusual that a child that has stayed beyond 13 weeks will have genetic abnormalities. Unusual, except in the case of blood incompatibility, where the mother and the father's blood don't match and then affect. There's a lot to that, but that is the only way that the issue can be from the child after 13 weeks of gestation. So for terminations of pregnancy happening before 13 weeks of gestation, there is a likelihood that the challenge or the problem causing that might be from the child. It could also be from the mother, like we have said, maybe hormonal abnormalities, illnesses, and stress. But if it is after 13 weeks, it's unlikely to be the fault of the child, and then we can have things like cervical incompetence as the cause, also maternal stress or illnesses that can be contributing to that factor. What can you do if you notice habitual miscarriages? The first thing, of course, is to go to hospital if you notice a miscarriage of any kind. The cause, the doctor will be able to do that by taking history and probably sending for a few investigations. Most times, miscarriages can be one-off, maybe as a result of a particular incident, trauma, illness, whatever. But when it becomes habitual, we'll now start looking deeper. It could be as a result of hormonal abnormalities, like we mentioned, or in later cases, what we call cervical incompetence. They are very easy conditions to manage and to take care of once they are detected. So if there is a hormonal insufficiency, the hormone is simply replaced in the woman, and when next she gets pregnant, the pregnancy can thrive. If it is a cervical incompetence, something that is called the cervical circlage is put around the cervix to ensure that the pregnancy stays, and then miscarriages in the second trimester is unlikely to occur. So take home from this is that miscarriage is termination of pregnancy before 4 weeks of gestational age. It can be early, that is before 13 weeks, or late, between 13 and 24 weeks. Usually can be caused by fetal factors like genetic abnormalities, or it can be caused by maternal factors like hormonal insufficiency, illness, trauma, and cervical incompetence. Best way to tackle them is, once you notice bleeding in a woman that is pregnant, go to hospital to determine the cause. Sometimes it might be just a threatened miscarriage, and treatment can be given and the bleeding stops and the pregnancy continues to thrive. If that is not the case, if you have a complete or incomplete miscarriage, it will be taken care of, cause identified, and then possibility of prevention in the future follows. This is where we'll be ending today's topic. Thank you for staying with us. Remember, you can always follow us on our social media handles: Facebook at Love Foundation or Facebook at Waiting to Conceive. You can follow us on Instagram at love_foundation_. Watch us on YouTube at love_foundation. Keep liking our posts, contact us, and learn to teach others. Thank you for staying with us. See you next week. Bye bye.